Hello, my name is Chase, and today we were going to be talking about the impact of exercise modalities on arterial stiffness in elderly. To start, what is aortic stiffness? It's the progressive loss of elasticity properties in the aorta, the body's central artery, and despite advanced treatments, cardiovascular disease, CVD, remains leading cause of mortality worldwide. How is it measured? Now there are different couple machines. We have a transdocular, this is a sphygma core, and we have a cavi as well. For the sphygma core, typically that is what we use clinical for our testings. Usually it's going to consist of usually a brachial cuff and a femoral cuff, and every person is going to be measured differently depending on their limb length. Those blood pressure cuffs are going to tighten up, and then we're going to measure basically from the carotid and to the femoral right here. Basically from that we'll be able to kind of tell the pulse wave velocity. Now the underlying issue is obviously the gold standard is the carotid femoral CF pulse wave velocity, and as you can see this is the range. So as you see from the 50 to above, 50 to 70, obviously a higher would be 81 and up, but the range would vary. But obviously for pulse wave velocity you want to have lower than higher. And as we age, we develop age-related diseases as cardiovascular disease, hypertension, and obesity. Arterial stiffness is a good biomarker, which would be the lead cause to finding out cardiovascular risk. And these can develop and create frequent mobility issues as sedentary lifestyles continue as we age, of course. And the hypothesis from all of this is that, as we'll go into further in our lecture, resistance training isn't really researched that much in our data, especially when it pertains to older populations, because moderate intensity for resistance training might be safe and effective for reducing aortic stiffness by improving endothelial function and reducing central blood pressure without harmful effects. Not a lot of tests are data collected from elderly population because the concern is traditional high intensity, maybe HIIT, resistance training can cause sharp blood pressures to spike, potentially worsening the effects. So if people are on blood thinners or on blood medication, for elderly, it might not be wise to do a very intense training as we think or as we assume. So not a lot of data or research is based off of it. The proposed mechanism that we are going to conduct is maybe resistance training can improve blood vessel function and reduce central blood pressure without the harmful effects of heavy lifting. This is from the research. I'll show you as we go more into the figures of what it is, but typically it is 90 participants. Each group was 30, so it's 30 for resistance training, 30 for aerobic training, and 30 for combined training, with the age of 50 to 70 with elevated pulse wave velocity of over 7.5 meters per second. So in the other picture I had earlier, it showed kind of the average. So anything above 8.1 was kind of in that danger zone. And for resistance training, it was 3 times a week with 60-70% of their 1 rep max, 3 sets at 8 to 12 in a circuit training manner. So it'd probably be, an example would be leg press, seated row, chest press, and leg curl. They would do 1 set, 1 set, 1 set, continue again. And for the aerobic training would be 3 times a week of 50-70% heart rate, 30 to 45 minutes, which would probably be a brisk walk or a cycle ignometer, which would be just cycling on a bike. And obviously combined training would be a mixture of both of them. Now, as we begin, as I mentioned, not a lot of data is collected for resistance training because of the risk. So starting with the figure 2 of this 2024 meta-analysis effects of aerobic resistance training and combined training of arterial stiffness, The overview from all of these studies here show that the low risk was very common, and there was almost little to no high risk at all. So that kind of shows that this risk zone is non-existent as we continue. And it's just to kind of reiterate that resistance training for elderly should be allowed as long as it is supervised. Now for this is the data for aerobic training as well. So this, as we can see from that 2024 article, this is figure 3. This is showing that from the studies, it showed that aerobic training alone was able to reduce pulse wave velocity by 12 to 16%, or 1.21 meters per second. Now that there is a lot of data for aerobic training, but what does this mean for resistance training and combined training? Well, how does exercise help from all of this? The ACM exercise recommended guidelines for an active lifestyle is 150 minutes per week. Majority of the elderly don't even hit 30 minutes of that. So to be considered sedentary lifestyle would be 30 minutes or less. As you can see, majority of elderly people that we know, maybe your parents or even your grandparents, aren't ably walking. Maybe it could be a combination of balance or other related stuff throughout aging, which is common. But where does resistance training play in this role? Well, exercise protocols on resistance training. Now every resistance training has different protocols, as we're going to go over circuit training, based training, but each clinical trial has to follow the same protocol throughout the data. So each data that's getting taken over by another professor has to be conducted in the same manner, which makes it hard to conduct training, resistance training for elderly, because, well, we can't really have them train a 1 rep max and then go based off of that, or we can't really have them do a squat. So typically when it comes to the elderly population, we focus on anaerobic, just to focus on the RR, the heart rate. And this is just kind of showing that this is kind of a trifecta: resistance training, aerobic training, and combined training. Now this is the article from the 2024 from figure 5. This is just showing that the different modalities. This is 3 sessions, or they showed from this that 3 times per week for circuit-based resistance training showed very good results, up to 7.8% in reduced pulse wave velocity. As you can see, it's not as good as aerobic training, but resistance training alone does show that it is effective in reducing pulse wave velocity. While less than 2 training sessions per week showed no difference. So as you can see, maybe 3 or more sessions per week does provide a reduction in pulse wave velocity rather than nothing at all. And this is just another study, figure 8, from a different effects of moderate combined resistance training from 2020, just to show that from these 8 dots right here, all these dots are different studies that show that on the left side over here shows that combined training does reduce pulse wave velocity. As you can see, it does show a big difference. And then this goes over combined training effects. Of course, this is going to be brachial artery pulse wave velocity, which we're just going to kind of go over. This was a different study from 2020, the effects of moderate combined training, resistance training on a 12-week body composition. And this was an isometric with grip strength. So another way for elderly people to test their muscular strength, or besides doing push-ups to see their muscular endurance, is an actual grip strength. It's an isometric way, which kind of helps show strength in different various ways. So this is a controlled group and the experiment group. And as you can see, the controlled group showed little to no benefit, while the experiment group showed majority of the results. So as we can see from this, that maybe different exercise protocols will give similar or greater effects. And for the results, the primary outcome method was for aortic stiffness, showing that carotid and femoral pulse wave velocity, so basic from here all the way down, did show that combined training was effective, and it did reduce it, but it wasn't as effective as aerobic training. The secondary outcome was a central and brachial blood pressure, body composition, blood lipid panel, which was on the last photo, that showed that yes, there were some results, but not as effective as the circuit-based training. And this is just to kind of reiterate the ACM guidelines. So usually you'd want someone to do 3 days of vigorous, 5 days if possible of moderate, to be maybe like 30 minutes, vigorous would be like maybe 30 minutes as well, to total out to be the 150. And it would be basically some resistance training, at least 2 non-consecutive days. These are just the general guidelines, of course, working on each muscle group. So as the guideline says, it's almost like they want you to hit each muscle group in a circuit-based manner, just to make sure that you are hitting every part of the muscle that you can. Now, the limitations, as you know, this wasn't any long-term studies, so it's a 12-week duration, no long-term effects. The results might not be generalized to the youth or healthier population. Of course, for elderly, it's really hard when they have underlying issues, maybe like hypertension, obesity, cardiovascular disease, and other stuff like that. The generalization of elderly population as a whole, and only some specific protocols as well. So that's just to reiterate that maybe central circuit-based training might not be the best protocol. We don't really know what may be the best or worst cause, are getting similar effects, of course. And the main takeaways: resistance training is safe but not be as effective as aerobic training alone. We need more data on combined training and other variety of modalities that could similar or greater impact than our aerobic training. And then we need long-term data, of course, to conduct for resistance training. The conclusion evidence shows that resistance training is safe and effective innovation to combat aortic stiffness, meaning that aortic stiffness is critical in monitoring cardiovascular risk disease. More data is confirmed combined training is more effective than aerobic training. Different exercise protocol is needed to further the study in resistance training. And thank you so much.